Hi, everybody. This is Kelly Dean. Welcome to our fourth Facebook Live this month. We are doing Diastasis Recti Awareness Month for the month of July. And so we have been spending a lot of time giving you guys a lot of answers about diastasis recti, separated abdominal wall, and specifically answering the questions that you guys have had the most for us. So we've done this series all month where we have been every day answering like the questions that are Googled the most about DR. And in addition to that, we're giving you resources every day on how you can get that information, take that information and use it and apply it into your daily life. So on Tuesdays, we have been doing a live and post where I answer questions. And this week we are answering questions about diastasis recti in men. So the thing is, if any of you guys have done any kind of research on diastasis recti, most people think it's a female-only issue. It is very common with prenatal and postpartum women because of the nature of the expansion of the abdominal wall and that happens during pregnancy and the uniqueness of the hormones in play that makes the connective tissue of the abdominal wall especially vulnerable. Okay, so when men develop a diastasis and they start looking for information, they have to weed through a lot of female information, a lot of pregnancy related information and all of that. But we actually work with a lot of men, and we actually have a Core Foundations for Men program, and it's we have a forum exclusively for men, and we work with men around the world, helping them heal their diastasis and not have to wade through all of the female related stuff. But the body is the body, and there's a lot of similarities between the anatomy of the abdominal wall, male or female. So there are a lot of similarities, but there are also some differences as well. So we are going to be answering your questions today. People have sent in questions, and if you want to post a question while I'm talking, I'll do my best to get to those. Okay, so my first question that I got from one of our clients, actually, Tom, said, 2 surgeons have told me that DR cannot be repaired and that basically I'm stuck with this for the rest of my life. However, I've begun to see results with the tummy team. Cool. Is there any documentation that I can use to refute these surgeons' assertions? So I'm going to address a couple things. It is very, very common to be told that either to be told diastasis is only healed or corrected with surgery, or to be told that surgery won't help and there's nothing you can do. And I always want you guys to be looking at what your source is when you're getting that. Surgeons can be incredibly knowledgeable about surgery and about surgeries that they feel confident in. And they're not rehab specialists. They're not confident in rehab processes. And to be fair, the physical therapy world has not addressed diastasis recti very effectively in the past. So it is historically not been treated well by rehab. So I think it's pretty tricky for people to say, hey, yeah, you could just go to rehab. So you actually need a specialist that focuses on the specific conditions of the abdominal wall and the things that are related to diastasis recti. And obviously the tummy team are specialists in this, and we train a lot of other practitioners to be specialists, and we have some trained practitioners on our website around the world that you could look for. But there is some documentation out there that this can be healed by rehab, but it's still, we're way behind and what people would think you can do. So what I tell all of my clients is, as you start to heal and as you start to feel better and you see a significant change, lasting changes, you know, we are asking you guys to be advocates. Go back to those surgeons, contact that doctor that checked you and said this can't be fixed, and show them that it's better and tell them what you did. We actually have resources we send to physicians to share with them about what we do. And doctors pretty typically are pretty excited that there is an option, because no doctor likes to go to a client and say, hey, I'm sorry that's happening. There's nothing we can do about it. We all are looking for solutions, and they may just not know that this is an option, and it's an effective option. Okay. So another question that we got is, what is the age range that you typically treat diastasis recti in men the most? And surprisingly to some people, I would say the majority of the men that I see are between 50 and 75, maybe even older. Occasionally I'll get in the 40s, and I have seen some young gentlemen, and I've also seen women that have never had kids. Women that have never had kids have similar things to men, but not really. They still have the hormonal component. There's other things going on. So we still treat men differently. So why would you say that the older men are presenting this way? And what we typically see for men, why it's different, why diastasis is even appears in men, is usually what's happening is there's a significant muscle imbalance between the internal corset, transverse abdominis muscle, and the external rectus abdominis or even oblique muscles. The rectus abdominis is that outermost washboard stomach. Your obliques are the diagonal muscles, the middle layer, and the transverse is the internal layer. And so a lot of times what's happened is the outer layers are stronger, whether it's from working out or from certain sitting postures or bent over postures where the rectus abdominis is kind of shortened because you're in a lot of sitting collapsed postures. And the transverse, that corset that wraps around, elongates you, gives you a waist, pulls everything in and up, has kind of been neglected. And so when those things are neglected, that muscle imbalance, what happens is people tend to collapse in these deflated postures, men specifically, and men are also in a lot of work postures with computers, maybe driving, maybe sitting a lot in office situations, and they're kind of bent over. And what happens is the upper muscles, the pec muscles, get really tight around the chest, and the back muscles get weak because they're kind of in this position all the time where these muscles are tight and those muscles are weak. The rectus abdominis, the core muscle, gets tight as well. All the pressure kind of comes down and out on the abdominal wall. And then the rib, because the pecs get tight, they pull on the rib cage, and because the transverse is weak, the transverse doesn't actually anchor the ribs the way it should be because it's weak and kind of deflated. And then there's chronic pushing out that happens, like getting out of bed, like heaving yourself out of bed, coughing a lot, holding your breath and picking up stuff like that, or pushing or getting off a couch. And what happens is they push out, push out, push out. And because the abdominal wall is not pulled together and there's this muscle imbalance, the pressure goes into the connective tissue, and it looks like a tent or a trench that's kind of, or an alien that's kind of bulging out in the middle. And that's what we typically see. They'll say, oh my gosh, what's this going on? And then with the best intentions, they start doing a lot of working out, a lot of exercises, maybe stuff they did in their youth, which tend to be a lot of crunch heavy forward flexion, which push out, or a lot of heavy lifting, which when their core muscles kind of not got that connection, they push out to stabilize instead of drawing in and drawing up to stabilize. And that consistently causes that muscle imbalance in that trench. Occasionally I'll see it in younger men, or men that are very physically fit, that have worked a lot on the external abdominal muscles and done a lot of crunches and a lot of powering through pain where they tense up their muscles but don't necessarily engage the core properly. And that's, again, another muscle imbalance issue that's happening, and it creates that that pressure out at the weakest part, which is the connective tissue. So it's not this connective tissue in women can get very stretchy and kind of very loose, and the abdominal wall can be really stretched out from pregnancy or post-pregnancies, and it can be a really thin abdominal wall and a really loose connective tissue. In men, Sometimes the internal abdominal muscle is pretty thin in comparison to the outer muscle, but so it is a strength issue, but it's a balance of strength issue. Okay, and what it often is happening is the connective tissue is not quite as thin, but there's still a lot of pressure on it, and so it thins because of the pressure and it separates. So as we start to retrain those muscles so the transverse can come together and that connective tissue can start to revascularize, and we start moving them in better patterns, and they start opening up their chest muscles, strengthening their back muscles, bringing the rib cage down and in so they're not barrel chested and pushing out. As we start doing that, the connective tissue heals pretty quickly because it doesn't have the same hormonal component. Also, men, just due to testosterone, build muscle pretty rapidly. So when they can get the right information to the right muscles, their muscles really respond really quickly. So those are all kind of components that make it a little bit different when we're working with men. The next question that we got was, is there a connection between men, their diastasis, and digestive issues? Absolutely. The intestinal tract is, housed underneath the transverse abdominis, and so if the abdominal wall is pushing out, the intestinal tract doesn't work as effectively. Also, if men have been constipated or have trained themselves to kind of round and hold their breath and bear down for bowel movements, then that pressure constantly goes out, and it can kind of consistently injure or cause that muscle imbalance to the connective tissue because of that pattern. Also, we've had people that say that because their abdominal muscles are weak and they're straining a lot with kind of holding their breath, that they can have some reflux symptoms and some like irritable bowel type stuff. Those are all kind of connected to an inactive functional core. So those are all connected and all usually resolve or improve pretty dramatically with functional core rehab. The other question they said is, how do men know if it's a diastasis or a hernia? So we have a whole video on the difference between diastasis and hernia. Hernia, the technical term of hernia is basically just something moving from an area in the body into a different area that it doesn't belong. So that definition means that kind of like if your organs are pushing out when they're supposed to be in, they're herniating. But medically, how that term hernia is being referred to is when there's a tear in the abdominal wall that needs to be surgically repaired. So the difference between a diastasis and a hernia is the diastasis is a stretching of the connective tissue, stretching sometimes severely, sometimes the connective tissue is really weak, and allowing kind of belly fat and organs to kind of press forward into that vulnerable or weakened connective tissue support system. But a hernia is when there's actually a tear or a really, really weak area where something can kind of get caught and stuck in there. And that can be really dangerous. So a diastasis is sometimes a precursor to a hernia. And this is also why sometimes men will more likely get a hernia than a diastasis, whereas women will more likely have a diastasis over a hernia. And that's because women, their connective tissue stretches more than men because of hormones. And so the stretchiness allows for it to stretch. Whereas if men's connective tissue doesn't stretch and there's a constant pressure, then it tears, right? And so that, I think, is also another factor why sometimes we see it a little bit more in older men, because their testosterone levels are shifting, and they have just a little bit different balance in those hormones. Also, the other hormonal component that is really an issue with men and women, but is cortisol. High levels of stress. High levels of stress can tear down and break up connective tissue. So if somebody is living with high levels of stress in their life, that keeps your cortisol levels really high, and that can cause damage and make you susceptible to several connective tissue injuries, not just a diastasis, but other injuries like ACL injuries and, SI joint injuries and stuff like that. Okay. So that's important to recognize. All right. Another question we had is, how is DR different for men versus women? And I think I've already kind of talked a little bit about this, but when you think about a diastasis, a separation of your abdominal, I'm going to stand up, okay? And your connective tissue goes all the way from your sternum all the way down to your pubic bone, and my belly button's right in the middle. What I tend to see in women is the weakness is right around the belly button. So it's widest at the belly button, a little bit narrower up and down, or it's weak at the belly button and below the navel towards the pubic bone. Sometimes we'll have a little separation above. In men, I tend to see it right above the belly button, almost like this, where it's like the gap is above the belly button to the sternum. And that usually is really related to posture, really related to chest tightness and ribs flaring out because the pec muscles are tighter than the transverse is strong. And that with chronic kind of collapsed postures or bracing of the belly, straining where they tense up the belly and push out as opposed to just a collapsed overall muscle. So men tend to have more of an upper diastasis, whereas some women have an upper diastasis, but more likely the diastasis in women is typically around the belly button and lower. It's rare for men to have it below the belly button. It does happen, but it's usually if there's some other kind of abdominal surgery or trauma that's happened. And then are there different limitations for, thanks Heather, that's really sweet. Are there different limitations for men versus women? No, not necessarily. We want to avoid chronic forward forceful pressure out on the abdominal wall whenever we're treating diastasis, men, women, pregnant, not pregnant. We want to minimize and eliminate as much forward forceful pressure as possible and replace it with kind of this elongating, knitted together, pulled together, pulled in and up sensation, okay? And so we still minimize and eliminate crunches, crunch-like movements and exercises. We try to eliminate any kind of bracing, holding your breath, bearing down, those kinds of things. We try to minimize the amount of kind of flaring of the ribs, pulling apart of the ribs that we see a lot more in men than women. We want to minimize all those kinds of things. Now, the one difference is that because men typically don't have the extreme hormonal component of pregnancy and postpartum recovery, and they build muscle quicker, and the connective tissue usually is not quite as thin when we're working with it. Men do tend to repair their diastasis faster than women, and we can get them back into a little bit more intense or challenging workouts sooner than women. And it's often, not always, but it's often because when we're working with women, it's related to recovering from birth, where there's a lot of other factors involved that we have to really be kind and nurturing to the body so that we don't damage them as they're healing from something else. And whereas men, this is usually been kind of a long-standing compensation pattern that now is just presented in this really extreme way. So we do have to kind of reverse some of those compensations and those habits and postural things, but they respond, if they're even just a little bit consistent, men respond really well and do really well. So if you're a man and you're like thinking, this is going to be too hard and it's too much work and I don't want to invest in it, I really encourage you to give it a try because you might not even realize all the components of dysfunction that are going on in your life that are related to not just a diastasis, but functional core weakness, which is connected to the diastasis. I think it's really, you don't understand that your low back pain, your upper back pain, your protruding tummy, even some digestive issues that, like we talked about, but prostate issues are related, pelvic floor issues, sciatica, SI joint issues are related, hip pain sometimes is related. All of this stuff is connected, and we treat all of it kind of together and give you confidence to get back to doing the things you really love. A lot of times when people get the diagnosis of a diastasis, it feels kind of like a death sentence, or kind of like a grieving process. Oh, I can't do this. 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 And what we like to tell you is, yes, it's important to know the things that are damaging yourself, because you would just keep doing it without knowing. But it's also really important to know what you can do and help you as quickly as possible getting back to the things you love in a way that's going to be really good for you. So I want to encourage people that are on the fence that we can actually help you. This is our specialty. This is what we focus on. We're not making stuff up as we go. We've worked with people in person for years, and we've been doing this for a long time, and we're good at what we do, and we're here to help you. Okay. All right, I have a couple more questions, and then anybody else that wants to leave a question. Specifically about DR in men today. I'm trying to answer those questions. If I have extra time at the end, I'll answer other questions. But the next question is from Cindy, and she said, "Can you elaborate on holding your breath? In what instances does this happen? Bracing and bulging, and when does this occur for men and for women?" Okay, so holding your breath is sometimes, it's often what I'm referring to is, it's kind of a strategy people do in little bursts. Like, think about this. If you're picking up something heavy and you kind of go, that's holding your breath. It's kind of taking a breath, holding it, and bracing, that kind of that we do. That is what I'm referring to with the holding your breath. And then if you're carrying something heavy for a long time and you're like straining like that inner abdominal pressure from your breath coming in and tensing up puts pressure out. And that strategy needs to be replaced with something more like where you exhale, zip up, and pull together with the effort. So you go to lift whatever, or push or strain, and it's going to be a factor. Bracing and bulging. Bracing is this underlying kind of tension that happens when we tense up a muscle. You kind of brace for impact, you tense up a muscle, and what that looks like in the abdominal wall is just this slight pushing out. And sometimes it's subtle and sometimes it's severe, and you see a bulge come out. Like I often I'll often have men come into the office or be online with me in an e-session, and they will show me oh, when I do this, it does this. And if I do this, it does this. And if I do this, it bulges out. And they show me every possible way that they can get that trench or that football or that alien to bulge out. And I'm like, okay, now we've determined all the ways that you can push out on it. And now we want to use that as a guideline. Avoid all those activities. All the activities that you just did, what pushed out and bulged it out, that is telling you that you're using a strategy that is pushing out on this connective tissue that we're trying to heal, and it will not heal if you keep pushing out on it. So I teach them to roll to get up. I teach them to scoot to the edge of the seat, draw the tummy in to stand up, to exhale and engage, and watching how much you're pushing out when you really want to be connecting those muscles. All right. So that's a big part of what that is. And sometimes it's subtle, and sometimes it's just a habit you do over and over. And that habit developed because your body was too weak to use the strategies the other way, or had a muscle imbalance, and you just powered through life. And that worked up to a point until it doesn't work anymore. And if you have a diastasis, if you have low back pain, if you have chronic sciatica, your posture and your strength and your strategies are no longer working for you. Okay. So that's something that you have to really, kind of consider, that though your body is communicating to you, and what are you doing with that information? Are you ignoring it, or are you responding going, oh, every time I push out, that's actually the wrong strategy? All right. This other question, and the next two questions are pretty similar. They're talking about sucking in their tummy. And is that the right thing to do? And they say, well, I suck in and I still breathe. Is that what you would recommend? I prefer to not use the words sucking in, because they really imply that you're doing that with your breath, which, did you see when I did that? It kind of flared my ribs up and pulled everything up, and that sucking in kind of pushes out on your rib cage to bring the diaphragm up. And what we encourage is actually exhaling, engaging, and elongating. So if you're with me watching right now, get to the edge of your seat, wherever you're sitting, kind of shift your weight so you're on your sit bones, okay? And then when you take a breath, I want you to put your hand on your tummy. When you take a breath, let your tummy just expand a little bit. And when you exhale, I want you to zip up your tummy like you're zipping up tight pair of pants. So that zipper is going to zip all the way up here. Okay? So that exhale and engage is how the transverse comes together, closes that separation, brings the two sides of the abdominal wall together, approximates the connective tissue so it can start to revascularize and heal, brings the right amount of tension to the abdominal wall. So what I would, instead of you saying, I suck in my tummy all day, is that what I should do? I think the quickest, easiest thing I can tell you is, instead of thinking of that, I want you to think about, I'm going to elongate all day. I'm going to visualize a cable drawing myself up, and I'm going to think about, how can I be taller, leaner, longer, up? That will naturally give you the right amount of tone in your transverse for posture. When you go to lift something, then you're going to have to exhale, draw that tummy in to hug and support your spine and your organs. Okay, but when you are just moving around life, as elongated as you can get is the natural amount of tone that you should have, without over tensing up, without sucking in, without clenching your butt, clenching your shoulders, doing anything else. You can elongate and everything can feel kind of like it's floating, kind of like, we call it long, lean, and lifted, where everything kind of comes up, and it's a lighter more than a tighter feeling. That's the goal of what I want people to be kind of implementing. And if you try to do this, you may immediately realize that you're maybe too weak to do it, right? But that's what we do. We build it over time. Okay, so I have a couple of other questions that have come through. Could you do a small video clip on how to activate your TA to pick up a heavier object? We have a lot of these actual videos within our programs and in our membership as well. So we have the online program, and then once you've gone through the online program, you can also become a member of that program, where you have ongoing access, and then we do lots of little membership videos. But basically, I don't know if I need to do a video on it, but basically you want to think about your pelvis and your rib cage lined up together, right? So when you go to bend over, if you're bending over in a kind of a curve to bend over like that, your stomach is going to bulge. But if you keep your back straight and you are able to squat, then when you go to pick up, it's the timing of that exhale to draw in. Most people can't start there. I think you can try, but we usually start with just basic connection and posture before we even start to challenge it with heavier objects. You know, so I would say that that's there's pieces, there's a progression of the rehab process. First, you have to connect to the right muscle, or you'll just compensate over and over. Then you have to get that connection into like a consistent way to activate and elongate. Then we need to work on getting you in the right alignment and maintaining that alignment. And then we start multitasking the core. Okay. I got a question from Martha a little bit back. Said the exercises and core foundations and the prenatal program the same? Not a men's question, but I'll answer it anyway. So with the core foundations, the difference between core foundations and prenatal core training, some of the initial exercises, yes, are very similar because the body is the body and the body still needs to work the same. The abdominals work the same. But we do, in the prenatal program, we take you through a lot of specific things to preparing for birth and birth recovery, including connection and coordination between the core and the pelvic floor for pushing and for birth and birth recovery. And so we go over pushing positions. We add, so the first couple weeks, there's going to be some overlap, but most of our clients feel like that overlap was necessary because their abdominals feel very different when you're pregnant than they did when they did the program when they weren't pregnant. So hopefully that answers your question. And then I got another question here that says, what's the primary reason complaint that leads men seeking help for DR? Great question. I would say, honestly, it's that they're self-conscious of the way their belly looks. They feel like they look like they have a beer belly and they haven't been drinking beer. We always think that women are the ones that are going to have the body image issues, and there's definitely plenty of that. But a lot of times men are like, there is this weird thing sticking out of my stomach, and I feel self-conscious, like going out in the boat and taking off my shirt. I feel self-conscious working out with other guys. I can tell something's wrong. So often it's that. But the other thing would be back pain, mid back pain, low back pain, combined with their stomach looks weird. It's doing something weird. Or the doctor, they maybe went in thinking they had a hernia because they had the bulging, and the doctor said, no, it's a diastasis. And then the doctor didn't give them any resources. So then they search online, what do you do for diastasis? And we have one of the only men-only programs for diastasis out there. So if men search for diastasis and men, they're going to find the Tummy Team because we created a program exclusively for men. So I would say that's the thing. So Heather, you're saying you have a membership. Cool. Could you point me to a video? So if you have a membership with the Tummy Team, you each course that you have completed, you have access to that course, and then there's bonus videos after that. And if you go to that bonus video section, they're all detailed out there, and they tell you what each video covers. So there's like how to pick the right chair. There's all kinds of different things in there. So you can email us too, and we can help direct you if we need that. Okay. All right. Any other questions from anybody about DR and men? Anything out there? I want to say that we have been really encouraged recently from several men that have written reviews and have sent us in their testimony and their stories, and that's been really encouraging because we are all about you guys. What you guys are telling us and your feedback directs the future of what we do and how we do it. So we've gotten some really good feedback from you guys over the years, and we adjust and modify our programs, and we update videos all the time so that we are staying fresh and relevant. And as we learn to do something more effectively, I refilm the video and give you the terms and the words and the ways to do it more effectively, because your time is valuable and I want you guys to get the most bang for your buck. Okay. So you guys have been so great this month, asking lots of questions and interacting with us, and we love it. And the July ends on Friday. So over the course of July, we have been doing this Diastasis Recti Awareness Month, and we have also been we also had a discount on all of our online programs in honor of DR Month. That additional discount is going to end on Friday. So if you have been on the edge and on the fence and you're not sure if this is for you, I encourage you to check out thetummyteam.com. Look at the specific programs that we offer for men, for women, prenatal, preparing for abdominal surgery, preparing for C-section, floor of your core. We have a lot of really great comprehensive holistic approach type programs and you can read the reviews and read people's stories there. And we want you to make an educated, informed choice, but we also want you to get the best deal. And that best deal is going to end on Friday. So if you've been on the fence, now is the time to take that leap and invest in yourself, and let us help you. If you have any more questions, you can post them here. We'll be checking this all day, and then we'd be happy to answer your questions. Okay? All right. Thanks so much, everybody. Have a great Tuesday. I hope you're having a good summer, and we will talk to you soon.